Unit VCS04 Lesson 1 Learning Outcome 1. Understand basic capture techniques. And Learning Outcome 2. Know how to approach, handle, restrain, move and recapture animals as part of routine husbandry. Within this session we will cover Learning Outcome 1 and Learning Outcome 2. We will utilise images, explanations and the video, and there will also be an adjoining handout on one file for you to complete activities. Handle and restrain common species in preparation for veterinary procedures. Handling and restraint is what we would class as an everyday activity in veterinary practice, and it is something that will be an intrinsic part of your role when assisting the qualified veterinary team. We must consider the welfare of the animals we are handling at all times. Bear in mind they are likely to be worried, frightened, sometimes they may be in pain, and other times they may be at the other end of the scale and be very excited about their visit to the veterinary practice. We also have to consider that an incompetent or inexperienced handling, inappropriate restraint and incorrect or poorly fitting equipment could hinder and exacerbate the animal's state of mind and could also result in harm or injury occurring. Prevention is certainly better than cure. Considerate, appropriate and thoughtful handling can generally prevent an animal becoming panicked or distressed and causing any unnecessary problems. Ensure that all means of restraint such as collars and leads are secure and tight enough to prevent their slipping their head out of them, as they may try and escape, and also ensure that windows and doors are shut to prevent cats and small mammals from escaping. Sometimes owner input can assist depending on how worried an animal is, but on other occasions, once the animal has left, the animal can become more amenable and go with the nurse quite happily. They will pick up on owner's body language and behaviour, and in some situations it can actually exacerbate the situation. What if animals are nervous or aggressive? In some severe situations, it may be necessary to chemically restrain a patient to protect both the animal and veterinary staff. This can be done in the presence of the owner, and we can use sedatives to do so. However, if we can carry out, movement of animal into the practice without this being done, then that would be ideal. But we do have to always consider the health and safety and any potential harm from being caused to our veterinary staff and the animal itself. According to practice protocol, we would recommend the use of muzzles to protect from biting, and it may be relevant, depending how your practice deems it, to leave a lead on the animal in the kennel to be able to get hold of that to help to avoid confrontation and the situation to be exacerbated, and then some will quite happily come out of the kennel. You may have heard of the term kennel guarding. Some dogs that we least expect to do this can actually kennel guard once in our kennel's environment. We do have to remember they are in an unusual environment, different smells, different sights, different sounds and different people. So if we can utilise aids such as leads or muzzles to assist us, then that can be very helpful. However, they must not be detrimental in their use, so any use of muzzles must not hinder the animal from breathing, and great care should be taken if we are leaving leads on within a kennel environment. So what are the aims of handling patients? We must ensure the safety of both the handler, the person treating the patient and the patient themselves. We need to ensure the animal cannot injure themselves. Try as much as possible to keep the animal's stress levels to a minimum. We also need to consider the reason that restraint is being carried out and not carry it out unnecessarily, but only when required, so such as for blood sampling, examination or treatments to be applied. And we must try to use the minimum amount of restraints necessary to achieve all of the above aims. and generally a less is more technique is preferable, and that is particularly relevant to our cat species. Preparation is always key. Ensure that you yourself are prepared. No jewellery that could harm our patients. Ensure your hair is tied back where applicable, so that you yourself will not be harmed, and also you're not going to obscure the sight or the animal, and this will also help to prevent contamination. If you also have another pair of hands available, that may also be very useful if required. You must ensure you wear the correct PPE is required to be worn, and ensure that is fit for purpose, such as disposable aprons and gloves, and prepare the necessary restraint equipment ready for use. Checking security of clasps, locks, etc. to make sure the equipment is going to work as required, and also that it is safe for use as well. Another key aspect of preparation is making sure that you are aware of the animal's temperament and any points to note regarding the animal being handled. We can glean such information from owners if we take part in the animal's admittance to the surgery, and it should then be relayed to other staff who are going to be dealing with that animal through verbal communication. We can also add it to their patient history or update it, and we can also use signage on kennels. This is a really useful tool to inform staff of the animal's temperament and the nature of the animal that they are handling, and also any points to note as to areas of the body that may be painful or uncomfortable that may link to the animal's reason for being in the practice that day. We should prepare all the equipment required for the procedures being carried out so that it saves time and unnecessary waiting for the animal. And whilst observing the patient while safely housed within its accommodation, take on board its current mood and temperament, and talk to the animal in a confident yet soothing voice. Within Unit VCS04, I will provide links regarding canine and feline body language. There will be some links to articles and useful videos explaining how we should interpret behaviour and then act accordingly. So when may an animal's behaviour differ from the norm? As we've already said, animals are going to notice changes when being within the veterinary environment, different smells, sights, sounds and people. But they may also be different or unpredictable or dangerous for a number of other reasons. Consider the following examples. A mother with a litter may act in a protective manner when she perceives her young are threatened. A sick animal may resent being handled. This may cause discomfort or pain. A singly housed animal may react in a more fearful or aggressive manner to those that are housed in groups. You as the handler should be aware of these changes and take the appropriate time and care to calm the animal, to avoid any possibility of injury or harm to either the animal or yourselves. An animal should be handled regularly within the home environment to accustom them to human contact and allow for regular clinical examinations. And this is something that we talk about regularly at puppy parties, first and second vaccination clinics and nurse clinics. The more accustomed an animal is to human contact and the examination processes such as ears, eyes, mouth, nose, genitals, paws, claws, all those areas being examined, then they are more familiar with it, rather than it being quite a daunting and scary process when they come into the clinic. And that may also be only on an annual basis, for example, for their booster. So actually by visiting the practice on a regular basis for cuddles with the nurses, collection of worming and flea treatments and regular weighing of the animal can really assist for them to be more at ease in the veterinary environment. And the earlier in the animal's life that this sort of process can begin, then the less stressful handling and actually just their time in practice will be in future. You should make yourself familiar with the appropriate handling equipment. The images below show you some of the examples, and these are particularly relevant to our cat species. So we can utilise the following: crush cages, restraining bags, cat muzzles, grabbers. We can also use gauntlets. But what I would say, and I would reiterate, is that a less is more approach is far better with our cat species. They do not like being handled. They can become very fearful about being zipped up into a bag, being placed into a cage and being crushed into the sides of it. So if we can use minimal restraint, i.e. gentle holding, then that is really, really useful. If we can use towel to make them feel secure, but without the need for being zipped into a bag or a cage, again, that can be very useful. Talking to the cat and soothing them is really beneficial as well. And we should not be utilising their scruff. Holding their head in a firm but delicate manner is far more preferable. And I really would recommend looking at the links available on your one file for this unit in relation to cat behaviour, and I'd also recommend the ISFM website and any resources in relation to good cat clinics, and also the cat nurse as well, who you will find details of on Facebook, who all encourage a less is more approach with cats. We can be quite gung-ho, and people can be quite scared of cats because they can be quite unpredictable and people are fearful of being scratched, bitten. However, if we do use the less is more approach, you will actually see the real benefits of this. So try and encourage this in practice and practice it yourself. And please utilise those links to assist you. So dog handling equipment. We can utilise dog catchers, muzzles, tape muzzles that are made out of bandage material if we will struggle to get into the vicinity of the animal to apply a muzzle in the normal manner. We can also use secure slip leads. We shouldn't be using choke chains or anything such as that. Again, we must make sure that all of the equipment is safe and ready for use and isn't going to cause the animal any harm. Here are some example images of the handling equipment that can be used for our dog species. Safety considerations are always paramount. We must never leave muzzles on either cats or dogs when they may be left unsupervised. This is due to the risk of vomiting and asphyxiation. We must also take care not to let dogs or cats scratch at the muzzle, as they could harm themselves and potentially remove the muzzle, thus removing the means of protecting staff from potentially getting bitten. Aids to assist us with small furries. We can utilise the following as seen in the image on the right hand side. Towels. They are really useful for making an animal feel secure and safe. We may use the term bunny burrito, which is quite true because we're wrapping them up nice and gently so that we can secure all four limbs, especially the potentially dangerous hind limbs, which can be very useful in relation to not only kicking staff but also scratching us as well. So by using such an aid, we're keeping them secure and safe, but also protecting ourselves and also them from any harm. How can we restrain dogs? We should use a suitable slip lead, as well as potentially a collar and lead that is secured safely. The purpose of a slip lead is exactly what it says on the tin, so that they can't slip from it. Whereas if we use their own collar and lead, sometimes you can find that the collar is quite loose, which could contribute to them being able to slip out of the collar and potentially escape. We should have the patient in a standing position and hold the neck gently but firmly on either side of the neck. Alternatively, placing an arm under the neck, encircling and gently drawing the patient's head towards us as the handler and into our body. And this is more suitable for large dogs, and that can prevent the animal from biting the handler or the person that's carrying out the procedure. General restraint of cats. Always transport cats in a carrier. making sure that the carrier is secure and safe for use. Check that doors and windows are closed. Take time to stroke and talk to the cat before lifting out of the carrier. To carry a cat, place one hand over the back of the head. Place the other hand under the thorax and grasp the forelimbs between the fingers, and lift into the handler's body, positioning the cat's hindquarters under the handler's elbow. Although this picture is dictating a little bit what is stated in the verbal means, you could probably think that the cat might want to have its head restrained more comfortably than in the image. And certainly, if we're thinking of keeping the cat calm and relaxed, we would like to hold their head more gently in comparison to the image provided. Cat restraint. The majority of cats do not like to be scruffed. And as you can see in this image, it isn't the nicest for either the cat or the handler. So if we can use gentle but firm handling, light restraint, placing a hand over the top of the neck, may be all that is required for physical examination. Aggressive cats will require more forceful restraint. In some situations, we would use other aids to assist us. So can we use towels, cat muzzles, or potentially cages to assist us? Scruffing is not ideal, and although it was done for many, many years, we actually now know that this can actually exacerbate the cat's temperament and actually can prolong any examination or test from taking place. So if we can do all of the above without scruffing the cat, then that would be ideal. However, if scruffing is the only means necessary, then we can hold the animal in lateral recumbency with the hind limbs drawn away from the body and held firmly between the fingers. But as I say, scruffing is most certainly a last resort, and I would really encourage the use of minimal restraint and looking at the resources provided for you regarding that. Carrying a rabbit, we've already said we should either hold it close to our body, but the most appropriate manner is to use a carry case. The first position, pictured as the most suitable for smaller rabbits. Hold the rabbit facing you with all 4 feet against your chest. Place one hand under the supporting the bottom, holding it against your body to stop it kicking out, and the other hand across the rabbit's shoulders. If you put the thumb in front of the rabbit's front leg, it should help to prevent any attempted escapes over your shoulder. Nervous or larger rabbits may feel more secure by placing their head under your arm whilst carrying them. Guinea pig handling. They're gentle animals with delicate bones. Some do have a tendency to jump, especially when you're returning them to their cage. It's particularly important you learn how to hold and carry them safely. Falls and jumps can result in broken bones, injury and sometimes death. We should support the entire body. Wrap one hand securely around the chest and place one finger between the front legs. Use your other hand to support the hind feet and the rump. That hold is particularly helpful with nervous guinea pigs that have a tendency to bite when being transported. Mouse handling. Adult mice can be picked up by the base of the tail by compressing the base between the thumb and forefinger and gently placing the animal onto a solid surface. We should rest the animal on our forearm and transport it some short distances. Prior to this, we would, however, use their carrier that they come in for transporting them around their practice. So by doing what we're stating at this point in time would be just in relation to the examination area. Larger mice, or those that are used to handling, can be scooped up around their body. Rat handling. Rats can be picked up by the base of the tail, as has been described for mice. However, extreme care must be exercised in relation to their body size. In an adult rat's body, their weight is greater than that of a mouse, and the tail could be damaged. And such injuries could occur in relation to fracturing coccygeal vertebrae, so those small vertebrae within the tail, or causing the skin to slip off the tail, exposing underlying tissue. So it's essential that the rat is to be picked up by the base of the tail as close to the body as possible. The rat should then be placed on your forearm or a solid surface. A rat should not be carried by the tail for more than a few seconds. This method is not ideal. So an alternative method is to pick up the rat by grasping the animal's body from above so that the rat is held firmly with your thumb and forefinger placed on either side of the animal's head. When held firmly, the rat is restrained and is unable to move its head to bite. Large mats may be picked up similarly, however the hindquarters must be supported with the other hand. Hamster handling. Males are generally more docile than females, and if simple precautions are taken, hamsters can be routinely handled with minimal stress to the animal and handler. Awakening the hamster from sleep will frequently be met with an aggressive response. Hamsters can be removed from their cage with the use of a small cup, which they will usually enter up, but they can be scooped out with cupped hands. To manually restrain a hamster, begin by placing the animal down on a solid surface, and the palm of hand is placed down over the hamster with the thumb near the head. The excess skin is grasped and gathered into your hand until the body warm is snug against your fingers. The animal will be immobile and will not be able to turn its head to bite. Gerbil handling. They're generally reasonably docile, however they can jump very well when they're frightened and may bite the handler if roughly handled. Simple transport of them will be carried out by cupping hands underneath them to move them from one place to the other. You should, as with all of the small mammals, ensure you approach them from the side and at a low level so as not to startle them. For more specific restraint, the gerbil can be restrained by grasping the scruff between your thumb and forefinger of one hand after having first placed the animal on a flat level surface. It is very important not to grasp the tail of the gerbil, as it will result in stripping of the skin of the tail, leaving exposed or denuded coccygeal vertebrae, and unfortunately the skin will never regrow and the vertebrae would remain exposed and gently drop off due to necrosis occurring. Note, jerboas and gerbil species that are related to gerbils and their handling techniques are the same. Utilising your access to vet logic, utilise Unit 304, the Handling and Restraint Unit, to encounter further common handling and restraint methods for different procedures, such as blood sampling, and complete aspects within the related task handout for you to complete that will be found within this unit on one file for you to explain how restraint will differ for such procedures. Just a bit of an overview now about moving animals from one place to another within the veterinary care environment. We must move them around the veterinary environment in a secure fashion. It is vitally important, and we must also not place animals in danger. We must consider the predator-prey specifics and also the potential risk of escape if we do not follow such procedures. So dogs must have either a secure, well-fitted collar and their own lead. However, many practices will opt for the additional security of a slip lead. Cats should be transported around the practice in a secure, and having checked that it is secure and safe, cat basket or carrier. If what the owner provides isn't secure, use your own practice means of doing so. And all small mammals should be transported in a carrier case or carrier that is secured and fit for purpose. Advice on the safe transportation of animals to and from the veterinary care environment. So as a member of the veterinary team, you'll be required to be able to advise clients on how to safely transport their animals to and from your veterinary practice. The same applies in relation to our cats and our small furries. Small furries should be secured in a small carrier, and that should be safe, fit for purpose, and not cause them any harm or discomfort. In relation to our cats, they should be in a secure basket or carrier that they would not be able to escape from. It is not appropriate to transport either of these species loose in people's cars. Security is key, because we've also got to be able to get the animal from the home into the car, and then from the car into the practice and then back out again. And we also need for them to be safe on arrival to the veterinary care environment. Again, considering the predator-prey specifics are really key, so we want cats and small mammals to be housed in these carriers so that they can't be seen, or not as easy to see by the dogs in the waiting room, particularly in veterinary waiting rooms where we haven't got separate designated areas for such species. In relation to dogs, we should actually be following the Highway Code, and Rule 58 deals with travelling with pets and states. When in a vehicle, make sure dogs or other animals are suitably restrained so they cannot distract you while you are driving or injure you themselves if you stop quickly. A seatbelt, harness, pet carrier, dog cage or dog collar are means of restraining animals in cars. Dogs must be secured and safe whilst travelling to the surgery, as not only can the loose dog easily distract the driver, but unrestrained dogs can also block the steering wheel or move it, and the same with the gear stick and foot pedals. And a loose dog could be injured or killed by an airbag. And when hanging its head out of a car window, debris from the road could injure a dog's eyes, nose and mouth. You will have seen as well over recent months that we are now being encouraged to make sure that a seatbelt harness is used for dogs that are simply placed onto the back seat, and this is so that they cannot move around the car freely. Rachel Kilroy, who is a senior veterinary surgeon at Vets for Life, advises that if a dog is not secured safely, then sharp braking or a collision could result in them being catapulted sharply forwards, and that could potentially cause life-threatening internal injuries as well as trauma to the people in the car, and it could also affect what the car is doing in the vicinity to other cars. So safety is of utmost importance. On arrival at the practice, dogs must be secure. They must have either a slip lead or a well-fitted collar and lead, or harness. You should advise clients to make sure that collars are not loose and that the dog would not be able to slip their collar. They may also need to seek assistance from a relative, friend, or a staff member if they need some assistance to lift the animal from and to the car. Cats must be secure in a cat carrier, and that must be checked to make sure that they cannot escape from leaving the car to the practice. They must then remain within this from and to the practice, as we've already said, and then back out to the car as well afterwards. We want them to be secure in our waiting room so that no harm comes to them. And again, as we've already said, small mammals to be travelled and carried to the practice and from the practice in their carry case or carrier. So why do we advise this? We must advise clients of such information to ensure their pets are kept safe and secure at all times. They are bringing their animal away from the security of home at times when that animal may be unwell or out of sorts. They may behave differently to normal due to this, and thus may be more likely to try and escape from the situation. This does happen on occasion, however, the better informed a client is, the slimmer the likelihood of this occurring. In summary, alongside the tasks and also additional links and resources found within this unit, we have covered Learning Outcome 1 and Learning Outcome 2.